Good afternoon, guys. Get things pulled up here real quick. Go ahead and click that. I'm going to switch the... There we go, so you guys can see what's going on. All right, just going to verify that we're good here. Awesome. So, talk about wellness and disease. This lecture is not going to be super long, but we do have some stuff that we're going to go over and make sure that we're... I do have some of the test questions highlighted in here, so get that stuff and make sure you pay attention to those because they'll be super important. So, wellness and disease. We're going to really kind of cover a broad topics of disease, but not really dive too much into a whole lot of other things. But the first one we want to bring up is not having a disease does not necessarily mean that the person is truly well or healthy. So just because you're you don't have any bad things going on right now health-wise doesn't mean that you necessarily are healthy. And this kind of flips that side around too, and we'll talk about that in a second here, that just because you might have a disease does not mean you're not healthy. So I remember speaking with someone that says that they told me that they were super healthy, and I was like, oh, okay, like what do you mean? Like, yeah, we only go to the doctor, we only have to go to the doctor 5 or 6 times a year, so due to things. I guess it means, I guess it means all have to do with what your perspective is, but this is saying that not having a disease does not necessarily mean that a person is truly well or healthy. So the CDC, we've all heard that a lot this year, but the CDC estimates that 70% of all diseases can be avoided by people making good lifestyle choices. And again, just because you're making good lifestyle choices does not necessarily mean you will be disease free. But so we're going to focus a lot on infectious disease today. But so this is the disease that it's communicable. We've all heard a lot about that with COVID. That disease is communicable. This comes from microorganisms. They live everywhere, including our bodies, and many are helpful to us. We talk about the bacteria that we need inside of our bodies to help us function. But unfortunately, infectious disease kill more people than any other types of disease. So these are diseases that we've caught through a virus or something like that. So talking about the leading cause of death in the U.S., we talked briefly about this at the beginning of the semester. The first one is, the number one is heart disease, and this is any type of heart disease, like we talked about at the beginning. So 647,000 people a year or died in 2019 from heart disease. And the next one is cancer, and then strokes. And here's the next 5: chronic lower respiratory disease, accidents, unintentional injuries, Alzheimer's disease, diabetes, and influenza or pneumonia. Notice that the coronavirus isn't on here because this was the survey taken back in 2019. Gastroenteritis and food poisoning. This isn't necessarily something that people often die from, we'll say, but this is definitely a common communicable or even catchable thing that we, unfortunately, probably all of us has experienced in some way, shape, or form. Both have very similar symptoms with nausea, vomiting, abdominal cramping, diarrhea, and even fever, but the causes are a little different. So gastroenteritis is a viral infection in the digestive system. So this is something that it could be something that we've eaten or places that we've been, water we've drank, but it's not food poisoning. So this is a virus that's inside of our intestinal or digestive system that we've gotten. Maybe we've traveled to a place that we're eating foods that we're not used to eating, or drinking water that we're not used to drinking. Food poisoning is different, and this is something that we can get from bacteria in foods that you consume. This doesn't necessarily have to be uncooked food or raw food or salmonella or anything like that. This could be just that the food itself, the bacteria that was in it, wasn't processed or cooked out. So that's the main difference between gastroenteritis and food poisoning. How to avoid those? Gastroenteritis, you want to avoid contact with people that have it, because that's how you can catch as well, other than just the food and intake you have. But then food poisoning, on page 393, there is a big list of, not big, there's a list of like 6 or 7 things for tips to avoid so that you don't get food poisoning. It is a test question, so I really recommend looking it up. Cold and flu. All of us have had a cold or flu before, and both caused by a virus. Cold is the most common infectious disease in the world. Most of us get colds and flus, cold up to six times a year, if not more sometimes. Runny nose, cough, sore throat, congestion. It can last up to 7 days. But yeah, like I said, people can catch it up 5 to 6 times a year. The flu is a little less common that a person's going to catch, but body aches, fever, loss of appetite. It is a respiratory disease, so the average person can catch the flu about once a year. The CDC estimates that the flu death is between 3,000 and 50,000 or 49,000 per year, and I know that's a pretty big number, but depending on the year and the flu strain that happens, it could be very different. Things to avoid to make sure that we try to avoid getting the flu or the cold is we want to make sure that we get enough sleep, because this helps build resistance, helps us heal and build up our immune system as we're sleeping. Actually, having a nutritious diet helps too, because we're getting the proper nutrition to help fuel our bodies. Obviously, avoid contact with people that have the flu. Wash hands. Having a humidifier or something like that, so that we can make sure that our system has enough humidity in it to be able to fight the correct bacteria, and then get the flu shot. So another kind of thing that we don't really think about when we think of disease or infectious disease is STDs, or sexually transmitted diseases. There's a vast number of STDs, more than we probably have even known, but there's so many strands of them too. The majority of people infected are typically under the age of 25. There's lots of reasons for that, but it affects more people annually than any other disease besides the common cold. So this is something that is actually a pretty big deal in the U.S. There are multiple types, but we're talking about 3 main types right here. The most common is chlamydia. It can be infants can catch chlamydia, and they actually can catch gonorrhea too at birth, which is the next one here. And then syphilis is another type. This can lead to premature death, because syphilis is probably one of the more aggressive forms of STDs out there. And then HIV/AIDS, and this is something that even over the last 30 years, all the money that's spent on it, there is really no cure for it, which is kind of unfortunate as well. Diabetes. So there's 2 types. We all know the type 1 and type 2. Type 1 is juvenile or insulin-dependent diabetes. Type 1 diabetes has to give themselves daily insulin injections. Pancreas does not produce insulin, usually develops as a child, connected to hereditary in many cases. So this is something that you're traditionally born with. This is nothing that you did or made a choice. This is just what you're born with. Now, type 2 is referred to as adult onset or non-insulin dependent. This means the pancreas cannot produce enough insulin, or body does not use the insulin properly. With that, 80% of people with type 2 are overweight. This doesn't mean that if you are overweight, you have type 2, and again, there's 20% of people that are of normal weight that do have type 2 diabetes. Type 2 diabetes can usually control their disease with exercise, weight control, but many need insulin shots or medication to help combat the side effects of having type 2 diabetes. There has been a steady increase in the number of people who have type 2 diabetes, and the reason for that is because there's been a steady increase of people becoming more overweight in the U.S. Over the years. The next one is gestational diabetes. This only happens in pregnant females. Oftentimes, once the pregnancy has come to term and the woman gives birth, then they relapse into gestational diabetes. They don't have it anymore. There's a risk chart on page 409 that can kind of tell you some things more of what to expect and like things that you might, like if I have these things, I could be more of a risk for having type 1 or even type 2 diabetes. Cancer. Basal or squamous cell carcinogen are forms of skin cancer. This is the most common types of cancer, most common type of cancer, but it actually has a 95% cure rate. So skin cancer is very curable because they can biopsy it and they can get rid of it. So that's really kind of something we need to be focusing on. The highest death rate of cancer of both genders is actually lung cancer, and obviously that's for the biggest one is due to the nicotine and smoking and tobacco. So that's the highest death rate. Breast cancer is the most prevalent in women. 62% of cancer death in men comes from prostate, colon, rectum, and pancreas cancer, and then also 62% of women cancers come from lung, breast, colon, ovary, and pancreas cancer. If cancer is caught early while it is localized, survival rate may be 90% higher for skin, colon, and rectum cancer because they can just biopsy that and they can take it out. So you want to make sure that you're paying attention to things and things that are different things and are normal, getting yearly checkups because, again, a lot of these cancers can be treated and can be biopsied as soon as they are found. Exercise with cancer. Cancer experts believe that 30 to 40% of cancer could be eliminated if people exercise properly, maintain proper weights, and follow proper diets. Again, some of these are, some of this, it doesn't correlate. So things like skin cancer, exercise won't really help for that, but sunscreen will. But they believe that 30 to 40% of cancers could be eliminated with proper exercise. Exercise is believed to be beneficial, protecting against colon, breast, and prostate cancer. And here's the thing, it's not 100% proven, but if there's an option that it would be an option for me to be able to be prevented against some types of cancer, I'm going to continue to exercise. Here's the final Easter egg. Email me your summer plans by April 29th at 8 p.m. for 5 extra credit points. Again, so yeah. That was it, guys. Super painless, I know. The next time we meet will be April 27th. I will lecture first, and then we will give the final quiz. The wellness survey is due April 29th, that following Thursday. Again, it's a free 20 points, so make sure you guys do it. And then the final exam is Thursday, May 6th at 8 a.m. And again, I'll remind you guys next time we meet as well. Thanks for watching, and we'll talk to you guys soon. Have a good one.